This segment of CoastLife is sponsored by BB Healthcare.
Well, not only is school back in session, but it is in full swing. And while your teens may be excelling in their academics, they may be struggling a little bit with anxiety and some other mental health issues that are a little bit hard to talk about. Maybe they're hard to recognize the signs. So here to help us out is Dr. Wendi Schirvar, a clinical psychologist with BB Medical Group. Thank you for coming in today, Wendi. I remember we chatted with you about a year ago, and Paige and I were just ready to pick your brain for everything that you knew.
Yes. Thanks for having me. This is an important topic and one near and dear to my heart. Anxiety itself is just one emotion.
Sure.
We have many, and all of them have levels of intensity. And a lot of times when we talk about emotions, especially with anxiety, we think about it as more a panic emotion.
Yes.
But what I want parents to start thinking about is anxiety has levels of intensity. And when your kid might be expressing or looking like they're anxious, remember that there's lower levels of emotions also that you can talk about with them. And that helps cope on a lower level before the emotion gets really big, possibly into a panic attack.
Sure.
And that's when we're talking more about clinical ranges of anxiety. And so when we're having fears of doing things, when we're losing sleep, a lot of times with teenagers, it'll look like irritability.
Which looks like puberty, which looks like, every teenager you've ever known.
So often we don't know. Is it clinical? Should I seek support? And so really, I encourage parents, first and foremost, is to improve your own emotional awareness. So checking in with yourself on how you're feeling so you're not relaying that to your kids. And also listen, be curious, talk less. It's something as parents we don't often hear, but I want to encourage parents to be curious about what could be going on with their kids rather than telling them what you think is going on. So are you worried about the test tomorrow? Are you worried, oh, you're not fitting in? Do you have enough friends? Don't introduce that to them. Listen and just be present for that. It's not your job to solve their emotion.
That is true. And I think, anxiety is something that we all deal with. So where are the signs that maybe, you're not dealing with just, okay, I'm worried about this test. When is it sort of a generalized anxiety situation that we're up against?
Sure. So what we think about as a clinical anxious presentation is when it's starting to really impact their life. So maybe you might see signs, and anxiety and depression are really what we call comorbid diagnoses where they can have coexisting qualities. And so rather than you trying to clinically assess what is going on, start looking for signs that maybe they're not their typical self for a period of time. Not a couple days, not just, when their friend didn't Snapchat like them, but, but really a period of time. So we're looking at, has their hygiene gone down? Has their food patterns changed? Are they enjoying things less? Are they starting to express more worries about a number of things? Some of the things that are really helpful to do in the home, and as well as tools that you can give teenagers and older kids to do when they're not at home, first and foremost is just building that emotional vocabulary in. So you start using words instead of just always anxiety, you have words like tense, worried, frustrated. So you're building that emotional vocabulary in your whole family and encouraging them as well to use those words. When teenagers are away and at school and they don't have you to kind of bounce this off with, some of really helpful things for resetting yourself. Actually, adults can use this too.
I'm listening.
So I always say we're beyond deep breathing. So what we want to do is we want to reset our system. We want to find some grounding of that emotion, and we don't want to act when we're in a high emotional state. So some of those grounding techniques that you can encourage young adults to use are going to the bathroom and splashing water on your face. Running cold water right here on your wrists because it's the closest area where your blood vessels are to the surface of your skin. So it will kind of recharge and snap you out of it. Just for a time being so that you can then approach that class or approach that test a little bit better. Visualizing positive outcomes. distracting yourself at times. So rather than my friend didn't answer me back because they don't like me anymore and I'm a horrible person and nobody likes me, what else could be true? So encouraging that balance of thinking, so that we're also introducing not a fixed mindset. So again, remember, when we're in an emotional state, we're not thinking clearly.
But say it is time to, reach out to a professional. How can parents that are, listening to this interview and think, maybe some of these signs sound like my kid, can they get a hold of you or somebody else?
Sure, and I'm sure you'll be able to post the contact information for BB. We have a number of providers in behavioral health, both psychiatrists and therapists, and myself, a clinical psychologist. There's a number in our community as well, and the best way I always encourage people to do is go on psychologytoday.com, and you can actually select what gender therapist you'd like to see, what are the specialties they serve, if they serve children, adolescents, do they take your insurance, do they have a religious affiliation. You can select all those filters and select someone that will match both your child's need and maybe some of the family values that you have as well.
Perfect, awesome. Well, Dr. Schirvar, thank you so much for coming in and sharing all this information. It's stuff I wish I knew when I was a teenager, but stuff I'm happy to know now as an adult, and thank you for sharing all your knowledge and your wisdom with us, as always.
Thank you. Thanks for having me.
Well, coming up on CoastLife, if you're a golfer and you like to give back to the community, we've got the perfect event for you. That's coming up.